Hi everyone, my name is Dr. Trish Harkins from Dublin, Ireland, and I'm reporting on behalf of Room Now at ACR 2022. Today I have the absolute pleasure of being joined by Professor Sattui, who, as many of you know, is an associate professor at the University of Pittsburgh, as well as director of the UPMC Vasculitis Centre. So today, Professor Sattui has very kindly agreed to discuss his abstract with us, abstract number 044, which is entitled The Prevalence of Frailty and its Associated Factors in Patients with Vasculitis. And he will be presenting this on Saturday, November 12th at the conference. So first off, I'd like to thank you, Professor Sattui, for taking the time out of your extremely hectic ACR scheduled to join us today to have a chat.
Thank you so much for the invite to talk about this. I think it's an exciting and newish topic in rheumatology overall, certainly even more so in vasculitis. So I'm always happy to have the opportunity to chat a little bit more of why I think we should pay more attention to it. I think it's something that certainly resonates and it's important for patients as well, which I think it's the nice thing, particularly of the VASC Strong study, which is how actually our patient partners actually named the study in the VPRN. It's a topic that resonates a lot. I think it's a topic that is important for patients, that it probably englobes a lot of the things that they see affecting in their daily life that we certainly don't necessarily conceive within our specific disease manifestations, right? So glad to talk about it.
Brilliant. And I suppose even just feeding into that, I suppose frailty is a relatively new concept in the field of rheumatology. So I was just hoping, even for anyone who's tuning in, if you could describe what frailty means to you, like how would you define frailty? Because I know there's a million different definitions and I suppose preconceptions about it. Mm-hmm. So if you wouldn't mind just defining it, how you see it.
Sure. So I think specifically, frailty usually has a very negative connotation, right? But I think as physicians, the way we see it is frailty refers to a syndrome that talks about our ability to, just putting it in simple terms, our ability to bounce back from different stressors, right? This physiologic reserve that we all have, that sure, it is conceived to actually decline with time, but at the same time, we know that it's not necessarily a synonym for age by any means. And this ability that we have to bounce back is affected by multiple things, by things that happen throughout our life. There's certainly an association with chronic inflammation that makes it even a more important topic in the context of rheumatology, and comorbidities and other things that happen through our process of life. So it's this bounce back ability that we need to certainly try to identify, because as we know, and our patients constantly remind us, they are affected by what happens through a disease, what happens with the treatments, what complications come with it as well. Mm-hmm. And frailty is associated, importantly, not only with, sure, mortality and morbidity as well, but it's also importantly associated with disability, with worse quality of life. A lot of things that are important that now that we incorporate more patient-reported outcomes as well, is a syndrome itself that englobes many of the things that we're trying to improve for our patients, many of the damage that we're trying to minimize, and many of the things that we try to improve just for better quality of life.
Great. I think even that last sentence just summarizes it beautifully. But back to your abstract. So if you could just briefly go through, I suppose, the methodology of it and the pertinent results from it.
Wonderful. Yeah. So the abstract of the VASC Strong study, which is the Vasculitis Strong study, is actually based in the VPPRN. The VPPRN is the Vasculitis Patient Powered Research Network, which is an internet-based cohort of patients, and it collects data periodically with regard to disease-specific medications and even patient-reported outcomes as well, and with regards to health-related quality of life. What we did for the VASC study is we actually queried patients, and we used the Frail scale. So the Frail scale is a self-reported, very simple, takes less than 5 minutes tool that leads to identifying and classifying frailty based on the fulfillment of this 5 criteria, and classifying patients or individuals as either robust, pre-frail, depending on how many of this criteria they meet. So patients were actually asked about this. We collected information about medications, about their disease phenotypes there, and different aspects of it as well. And we just measured the prevalence of frailty and actually also assess the correlation with health-related quality of life measures. And specifically, we're looking into factors that were more associated with frailty. So what we found is a high as expected. Again, and these are patients who have had the diagnosis for a certain amount of years. So this is not at the beginning of disease, at least for most of the patients in the BPPRN. But frailty was quite common, and it certainly differed in its prevalence between, and the ANCA patients are particularly the majority of the group, but certainly we have patients with Takayasu, we have patients with urticarial vasculitis who also participated. And there's most of bottom line is prevalence. The prevalence of frailty was high among the whole cohort, but certainly even like when you look into specific subtypes as well. Frailty was not surprisingly associated with a worse health-related quality of life in multiple of the domains as measured by PROMIS. And we actually found an association with between frailty and female sex, and specifically obesity. So either kind of overweight and obesity, which is important because when we usually conceive of frailty, we actually talk about weight loss, right? And unintentional weight loss. But the fact is that our patients are on steroids. And this concept of, thin or cachectic, sure, it does. Probably we don't necessarily see it, but most of our patients we know have issues with weight because of it, but it's probably more of sarcopenic obesity that we're potentially capturing as well. So it is a change of what we kind of conceive and just over what we would conceive in general population. And there's some specific kind of factors that are different in our patients, but are certainly something to kind of keep in mind. That's kind of this baseline analysis in a nutshell. That being said, the second phase of the Vasculitis study, which is actually
segueing nice into it.
Exactly, which the data is being collected right now, it's a 1-year follow-up of the 300 plus patients who participated, who are actually eager to participate, and that's again the nice thing of BPPRN. This is patients are in the kind of the front seat, and they're actually driving a lot of the research in this network, is collecting data on specific outcomes. So what has happened in this last year with regards to hospitalizations, with regards to vasculitis flares, with regards to infections, with regards to fractures. So, okay, we know that frailty is prevalent. We know that what factors that might be associated to. And we've certainly expanded a little bit that on the analysis for the manuscript, but we need to know what it means as well, right? Mm-hmm. And in order to start planning, okay, what does it mean for patients? How it is affecting them? And what factors? Who is at higher risk? Certainly, frailty is also dynamic, and we're actually capturing frailty as well in the frailty measures in the follow-up, in order to start thinking of how we intervene. How we actually identify who's at higher risk, what does it mean for them with regards to disease specific, and how we can actually minimize or ameliorate frailty in our patients.
Yeah, oh, it's so exciting. And thank you so much. I think that's covered it absolutely perfectly. I think frailty is so important. I think we're just at the beginning. Thank you so much for all your work in it. I'm so excited to follow your future work in it as well. And again, thank you so much for taking time out of your day to talk to us today. Thank you as well for anyone who might have tuned in. I'd encourage everyone to subscribe to Room Now and follow us all on Twitter for all things ACR 2022. Thank you so much.
Thank you.